I'm going to go ahead and get started.
Great.
Thank you so much, everyone, for joining today. This is the Blockchain in Healthcare Today Colorado chapter meeting. I'm Erica Bierbauer. I'm the lead ambassador for the Colorado chapter of Blockchain in Healthcare Today. And we're super excited. We are sponsored by BurstIQ, and we have Rob Lubeck doing a great presentation. So I'm going to talk a little bit about the journal, and then I'll hand it over to Rob. Okay, so Blockchain in Healthcare Today is an open access, online only peer-reviewed journal published on a continuous basis, really just educating healthcare stakeholders and really anyone interested in learning more about blockchain in healthcare today. We have a world-class editorial board offering rapid peer review. We have great reviewers, and then there's 102,000 downloads, 76 plus citations, and readership in 70 countries. That's probably even a little bit old. I think there's even more at this point. Some interesting things about the journal is that they do submissions and publications tracked on the blockchain via the Artifacts research portal, which is a really cool new project where you can actually see the progression of your publication on the blockchain. Also, just announced today, the article processing charges are now accepting Bitcoin. So you can pay your article processing charge with Bitcoin now, which is also really exciting. So as a clinician, I go to this journal to look up anything in blockchain and healthcare today. Sometimes it's hard to find articles around use cases that you're looking for in the current indexing systems that are out there. So this is a great resource just to go to the journal website, and subscription is complimentary. As you can see, there's that link at the bottom there. It would be great if you could subscribe. It's free, and you'll get up to date news on all of the current things going on in the field, which is, as you know, constantly changing and evolving by the day. So I am the lead ambassador of the Colorado chapter. Our goal is really to just bring people together that want to learn more about blockchain in the healthcare field, and maybe collaborate on writing a paper, or even like writing lay and gray literature on blockchain, such as like opinions and reviews are also really encouraged. We also just want to collaborate in the space and know that we all have each other, and we want to propel this technology forward in the best way possible. We have a LinkedIn chapter page. We have the chapter page on the Blockchain in Healthcare Today website, where this presentation will be available for you to view, and the audio will be there as well. As you can see, there are chapters all over the world, all over the United States, kind of driving the same mission. And we're super, super lucky to be sponsored by BurstIQ. And there's the BurstIQ website at the bottom. Today we have Rob Lubeck. He's the Chief Growth Officer of BurstIQ since 2019. He has a background in startup and growth organizations across multiple industries. And he's heading the COVID-19 vaccine tracking efforts. And this is what the presentation is going to be about today, how BurstIQ is using their blockchain solution for efficient and effective vaccine information exchange. So we're going to hear about that today. I'm really excited with all the stuff that BurstIQ has been doing. And so we'll hear about this today. And then I just have their mission statement here. And in case you're interested in learning more about their technology and what they're doing, the website is at the bottom. So with that, I will turn it over to Rob. Thank you again for presenting. And I will take questions at the end. There'll be time for that.
Thanks, Erica. Thanks, everyone, for joining today. It's a pleasure to be able to present this solution to everybody. I want to start out with a little poll. Let me make sure this works. Just to find out kind of what you guys know about blockchain, since this presentation is about both blockchain technology and our vaccine administration and testing solution, which is all kind of combined together to make a very robust solution. So let me start the poll. And I'll give it about 30 seconds to a minute. Okay, thanks everybody for participating in this. I really appreciate your help, and this will kind of help direct the flow of this presentation as well. So I will go ahead and share my screen right now for our presentation. All right, so once again, I'm with BurstIQ. I'm the Chief Growth Officer. It's really my pleasure to share with you one of our most relevant solutions that we've been marketing and selling in the marketplace over the last 30 to 60 days. And it really is a full end-to-end COVID, both vaccine administration and COVID testing solution based on blockchain platform. So if you've watched the news lately, every state, every city has just been ridden with issues around the solutions that they've been trying to put in place. Deloitte put together, I think it was an $85 million solution that has not been working well, but everybody's complaining about scheduling problems or people using backdoors or people sharing their links so anybody can book appointments. So there's just been so many problems that I think a lot of states and cities have just gotten, and private companies just gotten a black eye around how they've been handling the administration and testing around COVID. And with that in mind, we offer a proven field testing solution. Once again, both administration and testing. It's fully plug and play. It's customizable depending on what you need. And we operate it on the blockchain platform, especially the BurstIQ platform, to really add a new level of enhanced security and interoperability. And with that, just a little background on BurstIQ. So we have been in, our business was founded in 2015. We've had an operational service since 2017. We've processed over 50 billion data points. And we have, I think it's actually over now 300 organizations on the platform, everywhere from startups that are building applications for healthcare to Fortune 50 companies and everybody in between. And really what BurstIQ is, we are a data exchange network and platform, and we build profiles of people, places, and things and enable the secure connection between them. So we 100% focus on the healthcare and identity industries. So once again, we are a global data network and health data to really connect and trust it at scale. We have kind of three kind of modes that companies and organizations participate with us. Everything from companies that are building smart products around the healthcare industry to storing data securely in the cloud, and then the whole data networks, which then gives you enhancements around data sharing and trust. Our solution really solves today's problems, but also is scalable and buildable for all the future needs that companies and organizations and governments will require. One of the things that's a little bit unique to BurstIQ is what we call a LIFEGRAPH. And basically, as a patient, I'm a profile. If I had a pacemaker, that would be a profile. My ohmic data is a profile. My provider is a profile. And even my education can be part of my profile. My financial application can be profile. And we use machine learning and artificial intelligence to connect all those profiles together to build a much more holistic view of the whole health system. Now, when I talk about vaccine administration and testing, that would just be one small part of someone's life graph. They can use that to get into restaurants or get onto a plane. But once again, it's one small part, but we connect all these different data sources together to build a much more encompassing view of the whole health system in itself. Okay, I want to do a quick poll. I'm going to stop sharing for 1 second. I've got one more poll for everybody that's more relevant around the COVID tracking solution. And I'll give everybody about 30 seconds to fill this one out. All right, perfect. Thanks everyone for participating in that poll. I'm going to go back to sharing my screen to continue with this presentation. So what we have is a really full end-to-end solution. I want to talk about each of the different aspects of the solution. And once again, everything is plug and play. It's customizable, so you can add or remove features that you may need or not need in any given environment. So on the patient application, which is the upper left, we have a full scheduling platform. And so they can log in, create an account, and then schedule for either the testing or the vaccine administration, depending on what open slots. They can do geolocation, so looking for sites that are close to them. So it's completely flexible of how that works. We also have advanced drug reporting. We're in the system. If they do have an adverse reaction, they can plug it in, and that automatically gets uploaded to the registries. We have a telemedicine component where if they're feeling sick or if they get a positive result from a COVID test, they can immediately initiate a telemedicine engagement on the application. And then something for now in the future is a COVID passport. So this would be verifiable proof that they've either gotten their vaccine and which ones and when it was given, or they've gotten a test and it's either positive or negative, hopefully negative, so they can start going into different venues and events as they open up. On the provider side, we have full recall and event tracking. So real time before the vaccine is given, it checks for recalls on the vaccines, the diluents, or the test kits. We have full inventory management, which I'll get into, but that's depending on the vaccine, we track whether it's to ensure that the cold storage has been done well and adequately, that it's been thawed correctly, and then none of the vaccine is kind of outside the constraints of the safety around how it's de-thawed and administered. Full revenue cycle management. We have a partner that does billing to both CMS and private payers. And they've handled, I think, in excess of $300 million in reimbursements around COVID specifically. And then a command center, which are real-time analytics. So the client or the government can see real-time what's going on as far as testing positive and negative and how they're doing on administering vaccines, missed appointments, how schedules are looking for that day or in the future. And then we play really mostly here. We're the blockchain platform. So all the data is stored on our platform. It becomes a single source of truth. We handle the security, the governance, the workflow automation, and all the rules engine. So it's really a seamless system. And then we can also then connect with what we connect with the state registries, which have required reporting on both testing administration. We can also connect with EMRs. Whatever the case may be, the connection happens from the blockchain platform. So the solution, as you probably know, when you go get your vaccine done today, you get a paper card, and that's if they have any left. I've heard several instances where they've actually run out of cards. It's still unfathomable today that we are still running on a paper-based system in today's world. So in addition to the paper card, we've created this digital solution that has a digital card, reminders, it's fully cloud accessible and fully secure to really create the guesswork, and it can't be falsified like a card, it can't be lost like a card. So it's a much more kind of future-proof solution than what the CDC is even offering today. So once again, patient scheduling. This is done so a patient can log into the system, they can look for certain sites, and they're able to schedule real time based on availability in the system and pick whatever they want to do, whether it's a first dose or second dose. We have the ability to have the patient schedule the first and second dose together when they do their first appointment, or we can have the patient schedule their follow-up dose after they get administered the first dose, depending on the vaccine, if it is a 1 or 2 dose vaccine. You know, reminders are critical because people forget their appointments or they didn't write them down. And so our platform allows full reminders, constant reminders up until the appointment. So to ensure as much compliance and them not creating a no-show, which we want to avoid at all costs, so we don't have wasted vaccines. On the provider side, the provider, it's a really easy interface to use and program. The providers can plug in what sites they want to do, and then they open up the slots depending on what they want to do for any given day of the week, or they can go as far in the future as they want. So it's fully flexible, fully customizable to whatever the schedule that the provider wants to implement. So the point of administration. So we have barcodes that tie in with the system. Everything is scanned throughout the entire process. So we ensure that we're in with the time and temperature limits. And it also, if there will be red flags, if something is scanned that's outside those limits, so it can be destroyed. It includes full clinical documentation. Once again, it can be parsed into an EHR, EMR. It includes the NDC and the UDI and the site. And then we also then connect directly to the state and federal reporting, and also the manufacturer for waste use and any adverse events. Inventory management, this goes from receiving the bulk vaccines into a center, receiving them, placed in storage, all the way to prepping syringes, whether that's done at the distribution center or the clinic, to the point of admin site. So it tracks every single event. It doesn't just track the lot number, it also has the NDC and UDI, the storage location. It manages the expiration inventory alerts. Really, so we're documenting the entire chain of custody from shipment all the way to vaccine in arms and everything in between. This is our billing, our revenue cycle management services. Once again, this is one of our partner companies. It's fully cloud-based, and they are also HIPAA compliant as well as our platform. And they do this all day long. And so they can get, once again, full reimbursement from both CMS, which includes Medicare, Medicaid. And I think they cover over 90% of the private payers in the country. And they have full dashboarding as well. Here's an example of kind of the command center and analytics. The bottom right is a sample from one of our clients. So it shows the number of encounters. They can track by daily doses, weekly doses, what's scheduled, how many slots are available, how many patients they have in the system, and then also the full demographics by race and everything else. And we can do table views and chart views, and they can be filtered to exactly whatever the specific requirements of each client. And everyone's talking about this whole registry thing, and you know, there's a lot of controversy around this, but basically what we have built is that we can support any registries out there. We're also our own registry in itself. It's accessible, it's verifiable, interoperable with everything else out there. And we're supporting both the current and the future standards. A lot of the standards are going to the W3C verified credentials, which we already support today. A lot of the new health wallets. There's a product in New York, which was just launched called Excelsior, which is doing the same thing. But our platform is customizable. So once again, they can either use the registry on our platform, or we can interface with other platforms to create that same service. A few sample customers. There are a couple that are confidential that I can't talk about today, but Bucks County in Pennsylvania, PEMA is the Pennsylvania Emergency Medical Association. And I'm excited to one of our favorites, one that we are actually supporting COVID testing at the Masters as we speak. So we started testing employees over the weekend, and then it's starting to go live today, going into the next couple of weeks. And that's the presentation. And now I will open it up to questions. And I think there are some in the chat, and I think Erica is going to be moderating all the questions.
Yeah, thank you, Rob. That was really, really great, and really encompassing end-to-end a lot of different things that have to do with the administration of the vaccine and tracking. So Indira, good to hear from you. Thank you for your question. This is coming up in the chat. Can the patient track vaccine available locations within a certain radius? Each location has its own registration process. Does this let the patient register in the hospital/retail pharmacy from this interface? So a couple questions in there.
So yeah, a few questions there that I want to make sure I get them all. But
yeah, I can break it down more if you want.
So basically, depending on who they're getting their vaccine from, they can go in the system, and whatever vaccine administration providers are in the system, they can search by radius, by geocode, to find, or they can search for a certain site if they're trying to as well. So that answers any question number one. Number two, if they are at a site, they can actually log into the system right then and there, log in and find out if there's available appointments at that site. Was that all? Was that everything on that question, Erica?
Yeah, it talks about how each location has its own registration process. Like maybe they require different things, or just a different process.
So they do. I mean, so anybody under this umbrella, we have a pretty consistent registration process. So if we've got multiple providers in one area, that should all be the same as long as they're under that BurstIQ administration platform. If they're using another platform, there might be some different questions, but we follow all the kind of qualification criteria, all the demographic information that's required, insurance information. That's the other nice thing, is they can enter that all into the system before they actually get the appointment. So it saves a lot of time when they're actually at the appointment. They're not having to fill out everything when they get there. But they do also have the ability to, when they're at that appointment, to fill out everything as well. So it is flexible in that regard.
Okay. Yeah, and then does this let the patient register in the hospital or retail pharmacy from this interface? Sounds like yes.
Absolutely. Yep. They can register whenever. And one thing I also wanted to kind of emphasize, this is not an application. They don't have to download an app from the web store. This is a web-based application. So all they need is a URL. So it's really easy to, whether on the phone or a tablet or their home computer, to access all the information whenever they need it on multiple devices.
That was actually my question that I was going to ask, is about all of the different, like the recall event tracking and the inventory management. I'm super interested in that because I'm a clinician, I'm a pharmacist, I've worked in the pharmacy, so I understand like cold chain tracking and recall management and lot number NDC type recall management. It can get really complicated. So is that something you guys provide as far as the fields to enter for that, or is that a separate application? That's what I was wondering.
Yeah, so it's one of the modules. It's a great question, and that happens throughout the scanning and when they input all the information about which vaccine they're using. So it's a real time kind of it goes up and verifies the systems that need to make sure there are no recalls. You know, California had a recall on the diluent a while back, so we make sure we go way beyond just the vaccine. So it's checked every time along the way. So there's multiple safety checkpoints that, once again, that patient's not getting a vaccine that's outside the scope of all the safety protocols around the de-thawing and storage of the vaccine, but then any other also recalls that may have happened outside of even the supply chain. So yes.
Who exactly is entering this information then? Is it whoever? Yeah,
whatever clinician is. I mean, we have partners that actually staff these centers to do it. Expeditionary health partners that are staffing and actually doing the vaccines, entering this. But then we also can we're working with pharmacies and other companies, and the pharmacists then are entering the information just like they would do anything else in their system.
Okay. I'm just curious about the additional workflow step for a pharmacist who's already like very, I don't know if you guys know, but it's really stressful. As far as that goes, but I know these are also not necessarily going through a pharmacy. It's, you know, you could be going through just like a vaccine administration clinic, which is where most people get these vaccines. They're not going to a pharmacy in most cases.
Exactly. Yep. So, exactly.
But it's interesting when you think about applying this technology to like all drugs, or like, you know, like tracking cold chain and administration of not just this, but other things. So it's interesting to think about how you can get this done in a streamlined way. So before I go on to the next question, Indira, does that answer your question, or do you want to ask anything else? Feel free to. She just asked another question. Do you want to ask, Indira, or do you want me to go over it?
I don't know if Indira can talk, but
okay, I'll go. Is it part of the?
I think all the participants are muted, to be honest.
Okay, cool. Okay, well, thank you. I'm going to ask. There's a question from Wendy Charles, and then another question from Indira. So I'll go to the next question, which was from Wendy Charles. How does blockchain provide a superior solution than traditional databases for this use case?
So there's several reasons, and I would even take, you know, there's traditional databases, there's blockchain, and then there's BurstIQ. And I think BurstIQ even adds a few more layers on top of kind of even the traditional, or even the blockchain and definitely traditional databases. So, you know, number one, we have all the big security boxes checked where we're HIPAA and GDPR compliant, et cetera. And everything is encrypted. Everything, whenever data is accessed or read, everything is fully auditable. We are decentralized. Everything is hashed, so we know if something is altered in the past, it can create red flags. The other thing about trust, you know, one of the things that BurstIQ offers is the ability to assign data to a particular owner. Traditional databases, whoever owns that database is the owner of that data. Where in the healthcare, it can be unique, where you can have different owners of different data, or you can have multiple owners of even the same data. Whereas a patient, if I go get my vaccine, I'm part owner of that vaccine data, and whoever the provider that actually gave me that vaccine is part owner of that data. And so with the BurstIQ blockchain, we have the ability to assign multiple owners to different data elements depending on the application. So it gives us a much higher level of flexibility. And because data owner is the only one that can have control and access to that data, it creates a higher level of trust around that data as well, that really only the right people at the right time have access to that data. So it's really kind of several layers of security built in. And And we do constant penetration testing and keep our database as up to date as possible. We do monthly audits and annual penetration testing, and we do an annual SOC 2 Type 2 certification. So we do as much as we can to ensure that data is as safe as it possibly can be.
Yeah, and from what I understand from the BurstIQ blockchain solution, it provides a level of kind of granularity that is not found out there. So yeah, I from what I understand, that especially in this case, it's very much necessary to have that. Well, actually, in all the healthcare, in the whole healthcare system. So
exactly. Yep, that's a great point.
Yeah. So then Indira is asking, when I took the vaccine, they did a couple of triage steps before I got the jab. Credential check and allergy sensitivity check. Does this interface take care of this to speed everything up?
It does. So we have all the requirements, and the biggest one, of course, is allergies, where if you do have allergies, they require you a longer wait period after the vaccine. So that's automatically programmed in the system where if a patient, when they're filling out their profile, does check the allergy box, then it's going to force them to do that mandatory longer wait period versus if they don't have allergies. So yes, we are following all of the rules and regulations that are defined by the CDC and the FDA and the states to comply to ensure that we're in adherence to all those. So it's a great question, but yes, we have those covered.
Cool. All right. Does anyone else have any other questions for Rob or for me? Okay, well, that was a really great presentation, and thank you. That was a nice, quick overview of the COVID-19 vaccine tracking solution from BurstIQ. And thank you, Rob, for the presentation, and thank you everyone for joining for the Blockchain Healthcare Today Colorado chapter meeting. And we will be meeting quarterly, and please subscribe and keep up to date with all of the things happening in this field. And thanks everyone for joining. Great to see you, Indira. And everyone have a great day.
Thanks, everybody.
Bye.
Bye-bye.